MedStar has 10 hospitals. Here we have the 4 in Baltimore, and the hope is that at every turn we are at the forefront of leading the way for cutting-edge care. As Chief of Surgery at MedStar Good Samaritan and MedStar Union Memorial Hospitals, my day-to-day involves executive leadership, interfacing with multiple disciplines in order to provide high-level care for the patients that present to each of the hospitals. General surgery encompasses many different aspects of surgical care. It can involve many different organs, many different body cavities. Through the years, it's evolved from an open approach to a laparoscopic approach, and now, most recently, a robotic approach, which really demonstrates the level of technology that is developing in our field. General surgery also has a facet of the care that's evolved called acute care surgery or emergency general surgery. And in that facet, there are many disciplines that help to ensure the care of the critically ill patient. So with the new technology as it relates to robotics, the hope is that we can somehow incorporate emergency general surgery into the use of robotics on a daily basis and at a high level. And with that, the acute care surgery is going to be incredibly important to ensure that patients that come to the emergency room or are in the inpatient setting and require emergent or more critical care, that they're going to be taken care of in a timely fashion. Many patients will have the need for a certain service when they come into the hospital, particularly if they're critically ill. Within a 4-hospital system, oftentimes we may have to transfer that patient to another hospital in order to provide that service. So MedStar is very fortunate in that we have 4 very good hospitals in this Baltimore region, which will allow us to optimize the patient's care and thereby improve their outcome. I always have felt that it's incredibly important to lead by example. So oftentimes that involves me operating as my staff would on a regular basis and taking call and doing things in the middle of the night. This is what I'm trained to do as an acute care surgeon to begin with. So by putting myself into the middle of the pack and working side by side with them, I not only get to know them extremely well, but I also understand the intricacies of the system and what problems might exist. At this point in my career, being in Baltimore and having returned to Baltimore after I trained here in 2002, it is, for me, the mecca of medicine. You have other hospitals here. The entire staff here is dedicated to following evidence-based guidelines, and it's a stimulating environment. That is something that makes me excited every day because I always learn something new every day, and I don't feel like I have all the answers, and it's great to know that there are other staff members and other disciplines that can educate me on a daily basis. I educate myself by reading journals. I interact and interface with the residents on a daily basis, which is great, and they are a fantastic crew. And then we have physician extenders who also play an incredible role in what we do here at MedStar. I think patients should come here to MedStar because they will receive compassionate, competent, and expeditious care. And the hope is that their family members will also feel that as well. And at the end of the day, the whole goal is to make the patient better and get them home to their family members. We all agree that the best possible care was given to that patient when they come to this hospital.